So if you hear that you need to brush and floss one more time, you're going to lose it, right? Well, what if I told you that poor oral health can raise the risk posed by COVID? Do I have your attention now? Well, hello again, folks, and welcome back to another Dentistry Made Simple video. My name is Dr. Kenneth Goods, and I'm a retired dentist from the state of South Carolina here in the U.S. Look, today's video is not an attempt to scare anyone, but rather to help educate you. That's why this channel exists in the first place. So check this out. Research published in the Journal of Clinical Periodontology shows that people with poor oral care can end up with more severe symptoms if they catch the coronavirus. COVID patients who also have gum disease are 3.5 times as likely to be admitted into the intensive care unit compared to those without. They're also 4.5 times as likely to need to be put on a ventilator and 9 times as likely to die from COVID. Good grief. Well, why would this be the case? Because poor oral health has been linked to making other diseases in our bodies worse. Now, I'm not going to overwhelm you with exactly how this happens, but suffice it to say, when the bacteria, which we all have in our mouths, builds up due to poor oral care, it gets more aggravated and aggressive. It starts to break down our gum tissue, finding its way into our bloodstream, and at that point, there's no stopping it from settling elsewhere in our bodies. But one of the more common places that this bacteria wind up is in the blood vessels of the lungs. This is why your dentist and hygienist get on your case from time to time. For a better understanding of what gum disease is and how to recognize it and help treat it, check out this video I made about it here. So is the same thing happening with COVID? Experts think so. With a person suffering from severe COVID, their immune system is operating in overdrive to fight off the virus, and that sometimes harms the body's own tissues at the same time. Having poor oral health can also cause the same reaction. So when you put the two scenarios together, you can have a problem. But Doc, you keep harping on the bacteria in our mouths, but COVID is a virus, isn't it? What gives? A good question. I think we've all seen pictures on the news of some poor patient in the intensive care unit on a ventilator, have we not? In many of those cases, that individual's lungs is not only being attacked by the COVID virus, but also by bacteria, something called a superinfection. If you know anyone who battled COVID, the possibility of them having pneumonia was high, wasn't it? This double whammy of a viral and bacterial attack has accounted for as many as 50% of all COVID deaths, according to some statistics. If something as simple as brushing and flossing can go such a long way in eliminating bacteria in our mouths, why wouldn't we do it? As time passes, it will become clearer exactly how oral health affects the progress of COVID, but it may be that for some people, all of these mechanisms are at play at the same time. But in the meantime, there is enough evidence to consider poor oral hygiene as a risk factor for complications in those who have COVID, and especially in those who are already suffering with conditions such as diabetes, high blood pressure, or cardiovascular disease, as these can be aggravated by poor oral health and are themselves risk factors for COVID. As a result, it's more important than ever to maintain proper oral hygiene. This means brushing twice a day for at least 2 minutes with a fluoride-containing toothpaste and visiting the dentist on a regular basis. Hopefully, you won't catch the coronavirus, but if you do, having good oral health and caring for your mouth could significantly reduce your risk of developing severe symptoms. Well, let's wrap up today's video, folks. I hope you learned something that you didn't know before. If you enjoyed this video, would you do me the favor of hitting that like button below, as it will help this channel grow? Feel free to leave a comment or question as well. Please consider subscribing and be sure to hit that bell icon so you can be notified of future videos on Dentistry Made Simple. Bye-bye.